Welcome to Vital Signs Podcast. My name is William Hatton. I am joined by Kelli Settles. She is so graciously in here to talk to us today about PACT, your PACT team, something you might hear about. I'm a veteran. I served in the Army for 5 years, and I get my health care through the VA. And so when I started out, it's like learning a whole new system. There's a lot of different things that come up, especially like figuring out what works best for individual veterans and stuff like that. And so one of the phrases that when I first started working here and when I first started getting my health care is PACT, P-A-C-T. And I didn't know what that meant. I know I was assigned to a PACT team, but I didn't know what that meant. So we brought Kelli in. Kelli, you are with, what is your official title? I always struggle with it. And it's not like because it's hard, but it's because I struggle in general.
Oh, no problem. That my title changes often too. So I'm the group practice manager, clinical access coordinator, also called. And then of course, right now I'm also the referral coordination initiator or team leader, or, so we're rolling that out as well. Yeah. So, but
I don't want to boast or put anything on you, but when I first started, they said, go to Kelli. She's pretty knowledgeable about how things run around here. She's been here for a long time.
Yes.
And you were one of the first people that came to mind when I'm trying to think about how to explain to our veterans what a PACT team is, how it works, why it's important for them to know.
Sure.
So why don't you kind of just walk us through in general, what is a PACT team, and why is it important for veterans?
Absolutely. So PACT stands for Patient Aligned Care Teams. Okay, so back, about 10 years ago, the VA started a journey where we wanted to deliver primary care in a patient care model. Right. Okay. So a team-based model.
Sure.
So when you go to your primary care provider in the community, it's usually a medical technician. There's a clerk usually at the front desk that checks you in for your appointment. The nurse or technician, get your vital signs, and then the provider comes in and sees you. Okay. But it's really just you and the provider, right? You and the provider.
That's your team.
Yes. Yeah. Well, at the VA, we strive for the patient to actually feel and have a true care team. So what you are assigned to is a medical support assistant, so a scheduler.
Okay.
You have an LVN, a licensed vocational nurse that's on your team. You have a registered nurse that's on your team. And then, of course, the PCP, the primary care provider, whether that is a medical doctor or a nurse practitioner.
Sure.
But that team ideally should take care of 1,200 patients. So about 1,200 patients would be assigned to each team. The way that the care is delivered through that model is we want the patient's needs to be taken care of at the lowest level possible. Okay. So if the nurse can take care of the patient need, do that, right? If it requires the provider, do that. But we also are teamed up with social work. We're teamed up with pharmacists. We also have several other multidisciplinary team members that are assigned to that PACT team as well. So you're really getting a whole health approach from primary care from the VA. Mm-hmm.
So I think as a veteran, it's helpful to know that, it's not just one person.
Correct.
As an example, I think, we here at the VA promote My Healthy Vet.
Yes.
And you might go on My Healthy Vet and message your team.
Yes.
I think it's a good resource to know that, your doctor is likely seeing 1,200 patients in general. But the nice thing about My Healthy Vet is you can send them a message and that it's not just one person one person that's going to, potentially see that message and maybe respond because, 1,200 veterans is a lot,
yes.
a lot to go through.
Yes.
But your message is going to be seen by everybody on that team.
Correct.
And so I think that approach in terms of making sure that there, your health is not being falling through the cracks.
Correct.
That your care, the people that care about your health care, they're going to be on it. And so, you said it's been implemented, this kind of model has been implemented for about 10 years. Mm-hmm. How has that transition gone over the course of the 10 years?
It's definitely a challenge.
Sure.
You know, it's a cultural change. To think of delivering care as a team-based model. So when we bring on new providers or new nurses, new clerks, there is a learning curve that occurs because it is a different way of thinking. We want the patient to be at the center of the care, driving the care, right? And so just like what you were talking about, if you send an instant message to your team saying, I just started this blood pressure medication, I'm not feeling well, I've been on it for 2 weeks now, my blood pressures are this. Let's say you just emailed your team that, right? Sure. Well, so the MSA or the nurse would likely see that message first. And then, of course, what we would expect to happen is the nurse to call you on the phone, walk through those symptoms with you, find out exactly what's going on, possibly even bring you into the clinic that day and see you as a nurse visit. Yeah. And we may need to adjust the medicine. We may need to, do different things, but you are able to get care that way and have care adjusted that way without maybe necessarily taking up a 30-minute provider appointment. We want to meet the need and then, of course, follow back up with you. But it may not take a specific face-to-face provider appointment to manage the need.
Well, and I think that's helpful. I don't know. I got my healthcare outside of the VA before I started working here, and you have to see a doctor. Yes. You don't know if there's a different nurse. Anytime you go to the clinic, you probably see a different person. I think it is comforting to know that when you go in, depending on whenever you go in, if you walk in, yes. You're going to see the same doctor, you're going to see the same nurses because the teams are kind of built that way.
Correct.
Do you see that kind of here? Like there's kind of like camaraderie or kind of like a sense of ownership when it comes to like your team. Like I'm on the purple PACT team. And so you think like, that group of nurses and doctors kind of bond with that in a sense.
Correct. And it does take time. It's like any relationship building. Those 4 individuals are really the main drivers of primary care. And so, yes, they have to have that team-based approach. They have to be good communicators with each other, of course. And then there's personalities too, so it all goes. But I do feel that over time, and what I've seen, the PACT journey at West Texas, we have come a long way from when it initiated to now. Used to, one of our biggest complaints from patients, I never get to see the same provider twice. I come in and my provider's changing. Well, we've really, really tried to retain and, keep these providers that we really like, keep these teams together, keep these nurses, with these teams. So that's been, I really think, a big shift. And we've seen it reflected in our survey scores as well, right? Patients, the feedback saying, I'm on this team. I've seen this provider for the last 3 or 4 years, and hopefully even longer. I mean, that's our goal, is to really keep the teams together.
Well, and that's good. Again, I think there's a benefit of seeing the same nurses. Like even like I had it's kind of funny. I'm like using my own personal life here, but I had an appointment this week for just a yearly checkup, and it was nice seeing the same nurse again. Yes. It's like, oh, I remember you from last year.
Yes.
Doing the same routine, checking blood pressure and all that stuff, and having that interaction. Obviously, I work for the VA. You work for the VA. We probably have a lot of interaction with staff members just in general, but like as a patient, it was nice to be able to like have that interaction. And then seeing the doctor again, it was the same doctor from last year. And so it was like, well, good. He kind of knows me, not like in a personal sense, but like, I feel like when I sat down with him and talking about some of the issues that we had last year versus what I'm dealing with right now, he, looking at the records and the information and being able to kind of use that as a source to help my healthcare improve with what kind of I need. It was nice.
Sure.
And so I don't know. I think in general, I think we as a culture probably strive for like team effort. And so yes. I think in general, this is a good thing for the veterans. And so, is there anything that you feel like is important for veterans to know about PACT, the way it works that we haven't really discussed?
Well, a couple of things have changed recently. So,
Okay.
for example, the new patient. So if you are considered a new patient, what does that mean? So what that means in VA definition is you have not been seen in primary care in 3 years. Well, that's a recent change because it was 2 years.
Okay.
So now, within 3 years, you're assigned to that team and you stay with that team. You will automatically unassign. So that's what people also may not understand. If you have a lapse in care, let's say you're doing great, you don't take a lot of medication, and you don't see the doctor that much. But it's very important to stay established, at least every 3 years, so that all your stuff stays accurate in the system.
Sure.
Your contact information, your address, your phone numbers, your email address, because now we're delivering care through virtual modalities. We're doing a lot of video connect appointments.
Yeah.
We're doing a lot of CBT, which is, the patient comes in and then we link the patient with the provider through the TV. And we're doing that a lot with specialty care as well. But all of those things stem from primary care. Primary care, your PACT team is your bread and butter. That is where you're going to initiate all other care from that source, right? So we encourage all vets, get involved with your primary care team. Know who they are, know who you're assigned to, know who your nurse is, your clerk is. Usually when you call, that's who you're going to get first, or the operator, and then where to ask or who to ask to speak to. So it's just better if, all around, just knowing who your team is.
Sure. So I'm a realist. I understand that some veterans are not going to like their care provider, their physician. In that case, what is the process like? If a veteran's just like, I want to see another doctor, is that possible?
Yes.
What is the steps for doing like that? Because I know it's a relationship. If you don't vibe with your doctor, that doesn't mean you're stuck with that person.
Correct. We always have you as a veteran have the opportunity to switch teams if you want to. Now there are things that we go.
There's
wait a minute.
Only so far you can go.
Yes, and I will tell you, and if it's medication related, or maybe you're not getting veteran what you want, but maybe it's not clinically appropriate, things like that. We do look at those things. But for the most part, the process is you request a provider change. That goes through the ambulatory care service.
Okay.
And so usually what happens is Dr. Hamid, he's the chief of ambulatory care. He usually reaches out because he wants to know, is it something that we did? Is it something we can improve on?
Yeah.
Is it something, so he'll reach out and then he approves that. And then my office makes that change.
Okay.
So, yeah.
Well, and I think the reality is, we want, at the end of the day, I have this feeling in my heart. I see it in a lot of other staff members that we want to do what's best for the veteran.
Correct.
And if a veteran's just not happy, we don't want them to just feel like, all right, I'm just not going to go. I'm not going to take care of my own health because I don't like my doctor. I think if you, as a veteran, it's important, and as somebody who's looking at, my parents and seeing, health related issues, I feel like at a younger age, need to take more responsibility for my health care. As a veteran, I think it's important to do that as soon as possible and be happy with what your care is. And if you want the right care, the right person, that's not an issue. I don't think we should look down upon that. And I think if a veteran changes healthcare, I don't think it's the end of the world. I think it's just showing that we're dedicated to our veterans no matter what the situation is.
Correct. And our biggest thing is we want patients to receive care through the VA.
Yeah.
I don't want patients saying, I get better primary care in the community. And if that is what, our patients are telling us, then, we have some work to do.
Look around, yeah.
And so I want patients when they walk in to say, the VA absolutely provides the best patient care, the best primary care. And if you're providing good primary care, that means that patients are not going into the hospital near as much, right? You're because your symptoms and your diseases and illnesses are being managed with that team. And so you look at those things like hospitalizations, you look at patients that maybe they set goals with their team, how they are reaching those goals. That's part of whole health. That's part of prevention and what we want to do, at the start today, and then we'll take care of you really for life.
Yeah. So in closing, I think it's important to get back to this idea that it is reassuring to know that when you are dealing with your healthcare, to know that it's not just one person. The PACT team is a good resource in terms of communicating. And I think that's a big part of healthcare that we kind of overlook is
yes,
you need to be able to communicate with your doctor, with your nurses and things like that. And so if you don't know who your PACT team is, you don't know if you've got a color,
Yes.
some people might not know the color. I mean, that's how they're broken up in
Right.
different colors. But, be sure to reach out to your doctor, be sure to reach out to your team. And if it's been, 3 years or more,
That's right.
I mean, you definitely need to get in touch because, that's a good resource for you. So
for sure.
thank you so much for joining us today. We really kind of, we do veteran profiles on Vital Signs podcast, but we also want to do education, provide information, and bring it into context for veterans. And so I really appreciate you coming here because I know you were gonna make it clear for us exactly what a PACT team was. So again, this has been Vital Signs podcast. I'm William Hatton. We're really excited. We have a new veteran profile to bring you later this month. So enjoy this, enjoy that. I hope you have enjoyed this. So thank you all, and we'll see you next time.